Hi everyone, welcome back to Sylvia's Beauty and Lifestyle. Currently not so beautiful as you can see, but today I want to share a personal experience with you guys, which is my recent eyebrow lift. So I'm 10 days post-op, so I had my surgery 10 days ago, and I would like to walk you through why I chose to do it, the process of doing it, the recovery of the results, and all of these things that you might be interested in. So I'm already looking a lot better. I know I still have some bruising, but I've looked worse. Trust me, on Christmas I still look pretty bad. So I will insert pictures after I'm done talking here and talking about everything. I will insert pictures and some video footage of the last 10 days so you can see how bad I really looked. And I want to warn you, it's going to be a little bit graphic. So I do look pretty bad, worse than this definitely. So if you don't care for content like this, please just scroll past this video. I don't want to shock you or anything, but it's been a long journey. It's been 10 days. So first of all, I want to address why I decided to get an eyebrow lift done. If you've been following my channel, you know that I've been doing a lot of non-surgical procedures for anti-aging. I've been getting Botox for 15 years, I think. Yeah, probably close to 15 years. I've been getting fillers. I've had chemical peels done. I do regular microneedling. I feel like I've been doing all the right things to slow down the aging process. And I think these procedures are great if you're in your 40s, maybe even your late 30s. But once you reach a certain point in your life, at least this is how I see it, this is my personal opinion, of course, these procedures don't really do much for you anymore. For example, the doctor who performed my surgery, he said that fillers really won't help much in my case anymore because my face is drooping. So I'm gonna end up with the filler all right here instead of where I want it to, where I want to have it. So this is also known as the pillow face. You've probably seen that with celebrities that overdo fillers. So filler is not a great option for me anymore. I don't think I'm ready to do a full facelift. I don't know if I ever will be doing one. I used to say no way. But the eyebrow lift, they actually refer to this as an upper facelift because it lifts everything from your eyes up. So right now, my forehead is smooth like a baby butt. Let me say that. My 11s are practically non-existent. But it is, of course, a surgical procedure that comes with risks, potential complications, and it takes recovery time, a longer recovery time, and it's, of course, also more expensive. So you want to make sure, if this is something you're thinking about, that you invest a lot of time into. I'm going to have to let my cats out real quick. If this is something you've been thinking about, just be aware that it's going to be pricey. It's going to take some recovery time. It is a surgical procedure that comes with risks and potential complications. But why did I do one? Well, a few videos ago, I talked to you guys about wanting to do a potential eyelid surgery because I've noticed that my eyelids were extremely droopy. Like, I didn't even like applying eyeshadow anymore. And I know that a lot of people, most people my age, they suffer from this condition. In fact, I'm watching a lot of YouTubers, mature YouTubers who complain about droopy eyelids. And I remember thinking, girl, your eyelids are not bad. Mine are the worst. So I was really convinced, and actually YouTube brought this to my realization. I wasn't aware of that before I started making videos, that my eyelids are extremely droopy, like terrible. I mean, go back and watch some of my old videos, or I can insert some before and after pictures as well. But I was thinking about getting an eyelid surgery done, upper eyelid. So I did some research. I found a doctor. I went to talk to my doctor. I was convinced that I'm the perfect candidate for an eyelid surgery. So he did say, yes, you do have some loose skin on your eyelids, but you would actually be a better candidate for a brow lift. And here's why. So my eyelids have always been hanging really low. So they were right at the brow bone, and which kind of closes your eye, and it makes you look tired. It makes you look old and cranky and angry. And over the years, the decades, I should say, when my forehead started drooping down, my eyelids came even lower. My eyebrows. My eyebrows came even lower. So he said, look at this, your eyebrows are even in some areas below the brow bone. That's not how your eyebrows are supposed to be. That makes you look completely out of proportion, your face. So I think you would be a perfect candidate for an eyebrow lift. And the positive here is that since the eyebrows and the eyelids are also connected, it will also lift the eyelids. So they very rarely do both surgeries. In extreme cases, they will do an eyebrow lift and an eyelid surgery, but they said sometimes it's overdone and then you can't close your eyes fully anymore, which will then lead to dry eyes, and they rarely do it, only in extreme cases. So I had, as you can see, my eyebrow lift has also had a big impact on my eyelids. So it was a good decision. I think it was the right choice. I just really wanted a subtle, refreshed look without looking overdone. So right now, my eyebrows may still look a little bit overdone, and I talked to my doctor about that. I saw him last Thursday. He removed some of my staples, and he said, yes, it will take probably about 6 weeks for the eyebrows to settle in the final position. Plus, I still have some staples in my head, so once all of that is out, it can start settling. So there are different types of eyebrow lifts, and the most common ones are trichophytic eyebrow lift and the endoscopic eyebrow lift, which is the latter is done a little bit more frequently than the one I had, which was the trichophytic eyebrow lift. And the reason for that is because it's a little bit less invasive. There are smaller incisions right behind the hairline, so the recovery time is a little bit shorter. The trichophytic lift makes an incision across your entire forehead, also right behind the hairline. So I think at this point I need to say I'm not a medical doctor, definitely not a surgeon. So everything I'm sharing in this video is information that was shared with me and also my own personal experience. So please, before you make any decisions about an eyebrow lift, talk to someone who's qualified to perform such a surgery. But I will share the information that was shared with me here. So the endoscopic method typically has a little bit less recovery time due to smaller incisions. They also use a little camera to adjust your eyebrows, and the recovery time is typically about a week, they told me. For the trichophytic method, the recovery time, as you can see, is 10 days now. It's been 10 days. It takes more like 2 weeks. I'm not really sure yet if my bruises will be gone completely by the 2-week mark, but I can finally see some improvements with my bruising. The swelling has all gone down, so when you see the pictures, I will also have some swelling at the beginning, but that is gone. I just have the bruises, and we all know that bruising takes a long time. Now, I saw my doctor last Thursday, which was 6 days after my surgery, and he removed some of the staples, but left a few more in, just to be on the safe side. And he was a little bit surprised to see me because I still had purple. I still had tons of purple under my eyes. Now it's finally a little bit more reddish blue. And he said it's not the worst he's seen, but it's definitely among the worst. So if you have a procedure done like this, your chances are that you may not look quite this bad, because I'm definitely on the worst side of bruising. And I should have known that because I do bruise easily, and my bruises take about 2 weeks to go away. So it's a full 2 weeks, yes. I was lucky enough to have 2 full weeks off work. I will have to go back this Friday for a couple of meetings, and I'm starting to get a little bit worried. I'm not sure if all of this will be completely gone by Friday, but I've ordered some special makeup. Hopefully that will help me to cover up some of the worst, and we'll see. Yeah. I also want to talk about the longevity of the results. So these are also slightly different for each method. For an endoscopic method, the results typically last several years, and for a trichophytic method, the results can last well over a decade. Now, the ideal candidate for an endoscopic lift has moderate forehead lines and wrinkles, while the trichophytic lift is suited for those with significant wrinkles. They will also remove a little bit of skin with the trichophytic method because they do an incision across the entire forehead, along the hairline, I mean. and they can remove some skin to make your forehead slightly smaller. So that was another reason why my doctor thought I would be a perfect candidate for that method. Now I want to talk about some potential risks and complications. Again, please consult your doctor to get the full extent of this. But of course, like with any surgery, there can be a risk of infections. I was on antibiotic for 10 days. So I took my last one today. No problems there. There can, of course, be scarring. There is going to be some scarring, and I don't know the full extent of it yet, but the incision is usually made right behind the hairline. So hopefully your hair will grow over it. I'm a little bit concerned because, as you guys know, I have frontal fibrosing alopecia. So as long as my disease doesn't come back active, doesn't become active again, it should be okay, I think, but we'll see. I'll just do some scar care once my staples are out. I got some gels and things like that. And then also you can have a bad reaction to anesthesia, as with all anesthesias. I got really sick right before I went into surgery for some reason. I don't really know why, but I did lay down for a few minutes and then I started feeling better. I didn't have any reactions to the anesthesia. There's going to be temporary numbness. So my forehead is not as bad, but up here, the front part of my head right here, that feels pretty numb. And it feels really weird when I try to brush my hair because I feel like the brush is not touching my scalp. Like I can't feel anything. And I don't want to push down too hard because I still have staples in. So they said the numbness will go away within a few months. The feeling will return in almost 100% of all cases, but it will take a while. Then, of course, there can be brow asymmetry if the muscles aren't adjusted correctly. I don't think I have that problem. So far, I'm pretty happy with the way my brows look. And those are all the complications and potential risks I can think of. Again, please consult your doctor to get the full list. So what happens during the procedure? Well, they took me in, they took my vitals, then the anesthesiologist came in and gave me a bunch of different medications that I had to pick up before my surgery day. It was just one pill of 4 different types of medications. I think I talked about those different types in some of the footage that I will show you. Some was for sickness and I don't know. I don't even recall, but I had to take 4 different pills before I even went into surgery. And then they made me walk into the surgery room, which is not a problem. I laid down, they put an IV in. Then he said he's going to give me something to calm me down a little bit or whatever he said. It didn't sound like he was gonna give me the anesthesia right away. So he gave me something supposedly like Valium. Oh yeah, they gave me Valium before. Oh yeah, I remember. One of the pills was also a Valium. But then I went in and laid down. They said an IV, and then he said he would give me something to calm me down, which I didn't realize that was already the anesthesia because the next thing I remember, I woke up in the recovery room. So he didn't really give me a direct heads up like, hey, okay, I'm going to administer the anesthesia now. You're going to be out in a few seconds. No, it didn't. I had local anesthesia done with sedation, and this just ensures that you're comfortable and pain-free throughout the procedure while you're still able to breathe on your own. Then the surgeon makes a trichophytic incision along the anterior hairline. He designs the incision carefully to allow the hair to grow back through the scar, which will make it then less noticeable over time. Of course, it will take a few months before all the hair starts growing back. I had a ton of hair loss right after I took my bandages off, and I was a little shocked, but it will take a few months for the hair to grow back. The incision may also follow the natural contour of the hairline, and it is usually planned to blend seamlessly with the hair follicles. So once the surgeon has made the incision, he gently lifts the skin off the forehead and separates it from the underlying tissue. Then excess skin can be removed, and the goal may be to lower the hairline, which in my case wasn't done, or to reduce the forehead size, which in my case I believe was done. So he cut off a little bit of skin and pulled up the skin to make my forehead slightly smaller. It may just be a millimeter or two. But one thing I can say already is that I have no lines or wrinkles in my forehead anymore. Then the eyebrows are carefully lifted to a more youthful and aesthetically pleasing position. So the trichophytic technique allows for hair to grow through the scar, which can then further camouflage it over time. So let's hope that works out. After the surgery, the surgeon typically applies a dressing or a bandage to the forehead. Actually, it was wrapped around my entire head, and you will see footage of that. This is to protect the incision site and to minimize the swelling. And that stays on for 24 hours. So the next day, I was able to unwrap my head and take a shower. They recommend just washing your hair with baby shampoo for the first 2 weeks, which is what I've been doing. And the entire process took about an hour. And like I said, I was under local anesthesia. I didn't feel anything, hear anything. So it was very comfortable. I woke up in the recovery room, felt pretty good, didn't have any pain at all throughout the entire recovery time. I must say that they did prescribe me some pain medication, but I never had any pain at all since my surgery. So the recovery process, let's talk about that for a minute. The first few days I was a little swollen, but it was manageable with some ice packs and enough rest. So actually the first day, the day of the surgery, I still looked best. I had only very minimal bruising at the outer corners of my eye. I was a little swollen, but not too bad. But then it got continuously worse over time until about Christmas or so. So they do tell you not to do any strenuous activities for the first couple of weeks. I actually, like I said, I felt really good. I just stayed in bed for the first day, just walked around a little bit every now and then I'm back to my normal activities already. I mean, I don't have a super active lifestyle right now. I actually want to get back in shape in the new year and start working out again. But I wasn't very active before my surgery, and I'm back at that activity level, I must say. I can do everything. You're not supposed to lift anything heavy for the first 2 weeks. But I really didn't feel very limited during these last 10 days. So I must say that I was a little bit nervous about the bruising at first. But with each day, I saw progress, and that kept me positive. I know that I still have bruising, and it may even look worse on the camera than it is in reality. If it comes out as black or purple, it's really not black and purple anymore. It's actually, some areas are more like yellow and green. So, you know, the whole color spectrum of bruises. It starts from black, purple, blue, red, green, yellow. So I think I will probably take a few more days to recover, and I will definitely check back in with you guys to show you how my bruises are recovering. But again, I'm someone who bruises very easily, and my bruises take forever. That's probably the negative side of any surgical procedure like this, a brow lift or maybe even a facelift, that you go in looking relatively good, right? And then you come out and you look worse, way worse than before. And it takes forever to recover. So I've heard that a lot of people, they suffer from depression during recovery from a facelift or maybe even from this. So I must say it's been a very quiet time for me over Christmas. I spent my time by myself. I did a lot of journaling, making plans for the future, did some light cleaning, watched some movies, and took good care of myself. So it was very quiet. I was definitely not presentable to the public. I did go grocery shopping yesterday, but I wore some glasses inside the store. And tomorrow on New Year's Eve, I'm invited to a friend's house. Yeah, I said yes, but so final results. I'm sure you want to hear me talk about that. I can't really say for sure yet. It's a little bit too soon, I feel like, since the bruising still detract from my eyebrow results. Plus, they still have to settle a little bit. I will definitely check back in with you guys in a week or so and let you guys know once the bruising is completely gone. Did it meet my expectations? I can't say yet, but I'm not disappointed. I know I'm still recovering. I don't regret it as of now. But I do have some tips for you guys if you're considering an eyebrow lift. So if you're thinking about getting one of these babies here done, just keep a few things in mind before you take the plunge. So first up, choose the right surgeon. So I had a really great surgeon who operates in the Salt Lake City area. So if you live in Utah or Southern Idaho, please feel free to reach out to me. I'd be happy to share his name with you. He's board certified. He was a great surgeon. He's also a nice person, which you don't meet all the time. Great surgeons are not always nice people, and nice people are not always great surgeons, right? So to have both of these things together is really a big bonus. And it's absolutely crucial to have a surgeon that you trust and who knows what he's doing. Again, try to find a board certified plastic surgeon with extensive experience in brow lifts. Mine does a lot of brow lifts. It's one of his specialties. He also does a lot of deep plane facelifts. And don't be afraid to ask for before and after photos of their work. This can help you, make you feel comfortable with their communication style during the communication and things like that. So my surgeon really took a lot of time during the initial consultation. He showed me a lot of pictures. He even put my pictures up on the screen, like my brow pictures before. So he really was very, very good at communicating all the things that I wanted to have answers to. The next thing is you got to know your goals and have realistic expectations. So take some time to think about the look you're hoping to achieve. If you have specific ideas, bring some photos, but also be open to your surgeon's advice and suggestions. And because he has experience, he knows what will work best for your face. Remember, the goal is enhancement. As with any plastic surgery, the goal is enhancement, not perfection. Nobody's perfect. Even the most beautiful people in this world are not perfect. So if you follow these tips, you're going to set yourself up for a smoother experience and the best possible results. So if you're considering an eyebrow lift, or if you have any questions, drop a comment down below in the comment section down below, and I'd be happy to help if I can. Thank you so much for watching this video and letting me share my experience. I hope this video gave you some insights into eyebrow lift. I will now insert some footage that I took during these last 10 days, also some photos, so you can follow my recovery progress day by day. I don't talk in all of these. Some days I just took pictures, and others I talked a little bit. So just check it out, and don't forget to like this video if you found this informative, and subscribe to my channel for more beauty and lifestyle videos, and you will see a follow-up video at the 2-week mark, hopefully. And thank you so much for watching. I wish you a wonderful, happy, and healthy new year 2025. Bye. Hi guys, so today is the first day after surgery. I had a brow lift surgery, as you've already heard. This is what I look like at the moment. I didn't record any footage yesterday on the day of my surgery, but I can give you a quick rundown of what happened. So I showed up at 8 a.m. It took them a while to take me in. They took some pictures, they took my vitals, and then all of a sudden I got really sick. I felt super nauseous, and they had to lay me down, and it took them a while to prep me. I think it was just nerves, but I felt really bad. My anesthesiologist said this has never happened to him before. No one had ever done that to him. Excuse me, my cat needs to go off. Yeah. So then they gave me a bunch of medicine right before my surgery. So I picked up 7 different prescriptions from the drugstore before my surgery, 4 of which I had to take before the surgery. So they give you all kinds of stuff. The first one was diazepam. So I guess this is, I don't really know. I don't remember what, it's used to relax muscles. And seizures, treat seizures, and that's I took one pill of that before the surgery. Then they gave me gabapentin, which I believe is for painful nerve diseases. It's used to help control certain kinds of seizures. Again, only one pill before the surgery. Then there is celecoxib. I'm probably completely mispronouncing all of these, so my apologies. And I believe this was for nausea. And then they also gave me a Valium. And then they sent me home with 3 things, which I'm still taking right now. So one is prednisone for swelling. The other one is an antibiotics. And then there's hydrocodone, which I guess has gotten a little bit of a bad rep lately. So they told me if I can get away with Tylenol, take that instead of the hydrocodone. But I must say I feel very little pain at the moment, or no pain, literally. I mean, I had almost no pain, just a dull headache yesterday, and I took a hydrocodone and I was fine. So then they took me into surgery, and the next thing I remembered is I woke up like this. So I feel pretty good. So I feel pretty good actually. As you can see, there is a little bit of swelling. There's definitely some bruising on my eyelids. I feel quite a bit of numbness here. I can now remove this dressing, and my plan is to come back after I take the shower. So they say 24 hours after the surgery, which would be now, I can remove the dressing. It doesn't have to be replaced. And I can take a shower, but not wash my hair yet. So I will do that. And then I do have staples where they stitched me back up, or stapled me back up, I should say. So that's not gonna look very pretty. I'm expecting the worst. I'm a little bit scared actually to see that. But my purpose is, my intent is to come back and show you guys, because that's what a full disclosure video is about, right? You are interested in seeing what this looks like, how I progress. And my staples, by the way, will be removed in 6 days, so the day after Christmas. And then they also sent me home with some of these washcloths, which I should have used yesterday. I used them once, but not enough to. So you, I am supposed to put them in ice water and lay it on top of my face for like 20 minutes and on and off again for the swelling, to prevent swelling. So I only did that once yesterday. But I'm not too swollen. Yes, I can see a little bit of swelling. Yesterday I had 0 swelling. Today it looks a little bit puffy, my face. And then also what they gave me is some witch hazel. So I'm supposed to apply some of this to my staples 4 to 6 times a day to keep them clean. And they also gave me some baby shampoo. So this is what I'll be using for the next 2 weeks to wash my hair. It says use twice daily beginning 48 hours after surgery, and continue use until post-operative appointment. So that will be next. Yeah, it says my post-operative appointment, I guess, will be on the 26th. So the day after Christmas, when I have my staples removed. So I'm going to do that. But yeah, let me be brave now, and I'm not going to do this in front of the camera. I'm just going to unwrap my head and jump in the shower. Well, not jump in the shower exactly, but get in the shower and yeah, take a look at my staples and get cleaned up, and then I'll come back on camera and show you what my head looks like. So you can already see that my brows are significantly higher now. I will, of course, add some before and after pictures. But this area feels pretty numb. I have no feeling. My eyelids I do have feeling there, but this area out here is a little tender. I guess that's where they pushed down and pulled a lot. And yeah, I think that's it for now. I'll come back in a little bit. Okay, so here I am. Here you can see my staples in my forehead where he made the incision. It's like, it was a zigzag line, so I forgot to mention that earlier, that before I went into surgery, the doctor came and he marked my forehead with a very bright marker, and they do cut in a zigzag line. It's not a straight line, and it goes all the way in here, as you can see. You can actually still see the marking. Yeah, it does not look pretty, that's for sure, but what shocked me even more, so I just rinsed off and a lot of blood came out of my hair. So there was apparently a significant amount of bleeding when I took my bandages off. They were pretty soaked in blood, dried blood, but I could actually taste the blood in my mouth as it was running down my face. But yeah, it's not a pretty story for sure. But what shocked me even more is look at this. This is the hair that I just very gently combed out. That's a significant amount of hair that I just lost. It's a lot because I have very thin hair. And as you guys know, if you've been watching my channel for a while, you know that I have frontal fibrosing alopecia, which is the receding frontal hairline, and to a point where your hair follicles scar, and at that point, regrowth of hair is practically impossible because you have a scarred hairline. So that was a little bit of an issue. That's why he made the incision behind the hairline so the scar wouldn't show eventually. But I'm a little concerned about the hair loss. So he did warn me that there will be, or most likely will be, shock hair loss. And this is how my hair reacted to the surgery. So it came out from all over. So it should be interesting to see once he removes the staples how much hair loss I will actually have in the front. See, and it keeps coming out. I'm not even pulling on my hair, just very gently. Yeah. He did say that the hair will grow back in the next 4 months or so. The hair will now go in a resting phase, for 2 to 4 months, and then I should see hair growth again in 4 months. I'm wondering if I don't know how bad I will look. I mean, hair is such a big issue for women, more so than for men, right? I've been thinking if it looks really, really bad, if I do want to get a wig, but then I may just cut my hair super short. I was just beginning to let my hair grow out a little bit again, but now it might just look absolutely ridiculous with this amount of hair loss. I mean, having long hair and super thin hair, it's, oh gosh. Yeah, I'm concerned about the hair loss. That's one thing I'm concerned about. Other than that, I'm not worried about my scar or anything, about the bruising. Again, I have really no pain. This is great. I don't think I want to go for a run right now, but I feel a little bit of light pressure on my forehead. There's definitely numbness, but I think it went well. But yeah, that's a lot of hair. Look, it's really a handful of hair. It's shocking, but yeah. So today is day 1 post-op, and I will keep checking in with you guys over the next few days. I will apparently have a very quiet Christmas. My kids already came to visit me before Christmas, so I'm fine. I should be fine. I was lucky enough to be able to spend the first 24 hours at a friend's house who took care of me and who also drove me to the doctor. And yeah, we'll see. We'll see. Take care. Have a great day, everyone. Hi guys, here's just a quick check-in on my second post-op day. And I'm going to make this very brief because I know I look my worst yet. So I have a ton of bruising around my eyes. I have quite a bit of swelling around my eyes. So they warned me of this, that the swelling and bruising will peak on day 2 or 3. So hopefully this is going to be the worst look. I know it looks scary. So I did wash my hair today for the first time. I got I think the rest of the blood out of my hair. I had to be really careful around my staples, and I didn't have as much hair loss today, so that was good. It was just yesterday we had these big chunks of hair, and I think some of that was probably cut during the surgery, so it was just loose hair. Yeah, I know I look bad, so please forgive me for showing this on camera, but in case you are interested in this kind of surgery and want to see the progression of the healing progress, that's why I'm on here. I'll be back tomorrow. Bye. Hi guys, today is day 3 post-op, and there's really not much new to report. As you can see, I still look horrible. I may even look worse than yesterday. I'm not sure. The bruising is probably very similar. It's black, dark purple, my color, but the puffiness is extreme. So I'm really hoping I've finally seen the peak of this, and hopefully it'll start getting better after today. I'm not sure. So I'm just going to make this a really quick check-in because I know I look really bad. But fingers crossed, hopefully I'll recover soon and I'll start looking better soon. Bye. Merry Christmas, everyone. Today is December 25th. I'm 5-day post-op, post-brow lift surgery. As you can see, I still look pretty bad, although the lighting doesn't really do me justice here. It's not as black as it looks on the camera. I feel like the swelling has gone down a little bit. So the swelling was at its peak on day 3, I would say. And today it looks a little better. I still have a significant amount of bruising. So if you're really thinking about doing a surgery like this, 1 week of taking off 1 week of work is not going to be enough. So I'd have to go back in 2 days. Thank God I have 2 weeks off. So hopefully it'll be okay. So I still have my staples in, as you can see, but tomorrow I have an appointment with my doctor and the staples will be removed. So hopefully that will help a little bit with the dull headache that I've been having. I don't have pain. Again, I can only repeat myself here. There's not a lot of pain involved. I just have these headaches, which I believe comes from the tightness up here with the staples and everything. Final results can't really say anything. It still needs to settle. I can't really say much more until the staples have been removed. And other than that, I'm feeling pretty good. But yeah, I look a lot worse than I feel. Trust me, I'm actually doing really well. It kind of stinks to have a Christmas like this, of course, but I did all my Christmas fun and family visits before Christmas, so it's okay. I'll have just a quiet rest of the week. And on New Year's Eve, I'm invited to a friend's house. I think I might still have bruising then, but we'll see. Other than that, I don't have much to report. It's just still the same old stuff. Feeling okay, looking terrible, but I'm hoping to make a full recovery here. I know bruising can take a long time to go away. So just wanted to check in, and I hope you guys have a wonderful Christmas. Bye.